I think a convenient way to explain to individuals the indication and thought behind the treatment recommendations for them is to first picture themselves, or help an individual picture oneself, on the spectrum between no hair loss whatsoever and complete hair loss. Hi, good afternoon. I'm Dr. James Calder of Ziering Medical, and am speaking to you today about the topic of hair loss management, and specifically attempting to bring to the public a greater understanding of the indications and diversity of therapy now available to treat hair loss. Both of these guys, representing the ends of the spectrum, visit our clinic. One would say, well, why does he need to come and see you? The reason why he, typically a young fellow with seemingly a full head of hair, comes to visit is that he has a genetic history that's going to set him up for hair loss in the future, and he's savvy enough to realize that there are therapies today that can help stave that off or perhaps prevent it entirely. He doesn't need transplant therapy. He needs preventive-oriented therapy to help keep the hair that he has in a healthy state. He's an easy guy to treat, and he's an easy guy to develop a game plan or strategy for. Similarly, on the other end of the spectrum, this fellow, who has visited us very late in the game, has only one option in terms of improving his look, and that is to embrace hair transplant therapy. Medical management doesn't offer any solutions here. In 2020, we don't have any therapies, even emerging regenerative medicine therapies, that predictably and reliably will restore hair that has essentially left the playing field. On the other hand, hair transplant therapy is a very viable option for this fellow, and has been always, and we can derive hair from the back of the head in the various ways that we can do that, move it into the hair's depleted zone, and partially restore a natural looking top portion of the person's head. So those two individuals, again, represent the spectrum of hair loss. More commonly, these guys come to see us. These individuals are in the middle of that spectrum. They have begun to suffer hair loss, yet they have remaining hair, but not hair that's destined to stay healthy without therapy. And these guys are the guys that we need to deliver the message to, that it's not just about replacing the hair that's missing, it's about protecting the hair that's still there. Hair transplant can replace missing hair. Medical management therapy, stem cell therapy, regenerative therapies derived from various sources and tissue types have the capability today to increasingly keep these existing hairs in a healthy state. That is key for this individual to achieve the goal that he walks into the clinic with and states to us as, I'm not happy with this look, I need to get this to a better place. So in sum, an individual who has lost hair but still has hair needs to fight the fight on two levels. He or she needs to protect hair that's still there, or it will predictably go away. And if there's hair significantly missing from any area, the transplantation or moving of hair of permanence and health into that area is a core component to the therapy. As a final recommendation to all of you who are dealing with hair loss or are fearful that you may deal with hair loss in the future, please consult a qualified medical provider and someone who is focused and dedicated to the treatment of hair loss. We at Ziering Medical do nothing other than see people day in and day out for the treatment of hair loss, and have helped thousands and thousands of individuals enhance and maintain their dignity and appearance through the provision of solid, well-founded, and cutting-edge medical management therapy. Be wary of the pop-up PRP clinic down the street who offers you an instant cure for a few $100s. Such things are the modern snake oil of society and are merely preying on individuals' vulnerability when it comes to hair loss and their susceptibility to opting for a quick fix to what really is a long-term committed management strategy. If you'd like to hear more about today's cutting-edge therapies to treat hair loss, please subscribe to us on YouTube or follow us on Instagram, and we'll keep you posted on the latest.